We are day one with Lisa. How are you?
Hello. Good. Today's probably the hardest day, but feeling very positive.
Feeling positive. So
Yes.
Lisa is 58. She flew in before the snowstorm
Yeah,
because
Thursday.
we do not cancel for snow. So she was smart. She flew in before the snowstorm. And yesterday we did for her a brow lift, upper blepharoplasty, a little bit of fat transfer, lip lift, deep plane facelift, deep neck lift, full face laser resurfacing. Did I get it all?
I think you got it all.
I think actually no. There's one more thing. I snuck in a little bit of lip filler.
My age-appropriate lip
I snuck in a
filler.
little bit of lip filler. Yeah. So, so you said today you feel like it's probably the worst day. Describe why.
I think just I'm tired. The sleep probably wasn't great last night, but honestly, since she took the drain out, my pain has subsided. That was really the problem.
Yeah.
Besides that,
So I use drains still for brow lifts. Actually, if you go back on my page videos, maybe 4 days ago, I did a video on why I still use a brow lift drain for one night. It's to prevent black and blue raccoon eyes. I don't use them for face neck lifts anymore. If people do complain about pain at all with this kind of stuff, it's usually the brow lift, and they usually say it's immediately better when the drain goes away.
I mean, because I feel remarkably better right now.
Good. You can tell she's a little stiff when she speaks. This is normal. So lip lifts make the area swell. I lasered you extra around because you had your vertical lip lines are probably the worst wrinkles.
Yes.
That makes the area swell. And then I did sneak in some filler. So we do have in our consents, we have, if there's something that I feel like I find out during the surgery that is actually in your best interests, that you give me, a little bit of grace to do what I think is in your best interest rather than waking you up and saying, gosh, I wish I could have done this,
Oh, yeah.
And so she had significant vertical lip lines. And when I did your lip lift yesterday, lip lifts lift upwards, and they also were trying to get the corners of the mouth to rotate inwards, and that can sometimes accentuate vertical lip lines because this coming towards the midline can sometimes crowd vertical lip lines. And so I was feeling that tendency of it's going to want to crowd your vertical lip lines. And even though we were lasering really extra with a serious CO2 laser, serious settings, serious passes, when I get that sensation, what needs to happen is I need to reinflate not the red part of the lip, but just above it, the white part of the lip where the vertical lip lines are. And the best way to do that is with a little bit of filler. And so that's why I took that liberty to say, you know what, we're going to not make your red lip fatter, but support the deflated tissue under the white lip.
Well, thank you.
You're welcome. So anyway,
I appreciate that.
But that also contributes to stiffness and swelling and weirdness. So that's why she's kind of speaking stiff and weird and not as great articulation.
Right.
Yeah, good. Well, turn this way. I want to let everybody see what you look like. So Lisa, I haven't told you this yet. Lisa had in her soft tissue layer, her SMAS layer, I'll show you a picture, almost a deficit. And this could be just born that way. It could be previous injury. It could be treatments. And you'll see there's a spot where it's almost just worn away and missing right there. So I worked real hard to get this contour. Turn all the way around. All the way around.
This one?
Towards that.
Sorry.
To be as nice as this contour. And I'll show you here and turn back towards the camera. I'll show you on screen. It was almost like a chunk of soft tissue missing there. So I really, really worked hard on that. I think we got it. It looks.
Thank you.
You're welcome. It looks really,
Didn't even
really
know
good.
I had it.
Well, I didn't either. It's funny. Sometimes you don't notice it till you're in process, and then went back and looked at your pictures. Like, yep, there it is. Anything else you want them to know about your first evening? And how are the nurses? Did they treat you well?
Nurses are amazing. Your staff is amazing. From the day I sent an email investigating to all the follow-up, you couldn't be more professional and genuine and amazing.
Well, thank you. Our goal is to make you super happy. Thank you for letting everybody follow
amazing.
along. I appreciate you.
I feel so fortunate to have had you.
Well, you're not done with me yet.
Hi, it's Kelly here, and I'm here with Lisa. Lisa is post-op day 2 from having a facelift, deep neck lift, brow lift, upper eyelids, lip lift, and a full face laser.
Correct.
Did I get everything?
Yes.
Okay, good. Yay. How are you doing today? I was in your visit today, so tell me.
I actually feel great. I know I don't look great, but I feel like myself again.
Yeah.
Zero pain. Yeah, I mean, there's no pain.
It's hard to believe, isn't it?
And amazing.
Yeah. And no pain from the laser either?
No, This morning it still felt a little hot,
Mm-hmm.
but not at all anymore. It's just tight.
Yeah.
Very tight.
Good.
Yeah.
And you got some sutures out today behind
Yes.
the little net sutures behind the ears that we put on every patient back here.
Yes.
So was that painful coming
And
out?
not painful at all. No.
Good. I appreciate you doing this with
No.
me, and thank you for sharing your journey with everyone.
You are welcome.
Well, I hear patients today even saying it means so much to watch these videos.
I mean, I watched these videos for months, and they really did help me.
Yeah, well, good.
That's
Well,
what
you're
I want to share.
Yeah, you're helping other people. Well, go ahead and turn towards me. I do want to give them a view of how you look. So just amazing jawline already. Even with swelling, you can tell that's going to be just fantastic. Sutures super tiny and little. Those will be totally undetectable. This was the area that we removed those post-auricular nets on right there. That's where the fluid would collect sometimes on patients. So we just put those in as like a safety net. So we didn't have to put them in after the fact. Yeah, everything looks great. Just beautiful. So
Thank you.
and she's peeling, so that's why she's kind of yellow and greasy and all that. She's doing what she's supposed to
It
be
feels
doing.
kind of good though.
Yeah.
Like I can smile a little more.
Yeah, that's right. Okay, well, thanks
That's
again.
great.
Really
Thank you.
appreciate it.
Thank you.
We are the 5th day after surgery with Lisa. How are you?
I'm doing good. Thank you.
Yeah, so she's making it look pretty easy. Lisa is 58, and 5 days ago I did for her a deep neck lift, deep plane facelift, a little bit of a lip lift, a little bit of lip filler into the deepest lines, full face laser resurfacing, upper lids, brow lift, a little sprinkle of fat transfer, and I think that's it. Did I get it all?
I think you got it all.
Okay, good. What's the number one thing that's bothering you right now?
That I can't wear my contacts. Probably.
Okay. Nope. We tell people not to wear their contacts for 10 days after eyelid surgery. So that's the biggest nuisance right now is the contacts.
Yeah, it's very difficult to see, and
Yeah.
I'm not used to my glasses. But everything in regards to the surgery and procedure has been spotless, like not painful, and
You're staying in our recommended hotel?
yes,
Okay. How have you been feeding yourself?
small bites.
Yeah.
Soft foods like what you have recommended, the yogurt, cottage cheese. I'll do noodles, chicken noodle soup.
Yeah.
Pretty basic.
Pretty basic
But
stuff.
it's actually what sounds good. So
Yeah. So especially after we do salivary work, we tell people we don't want them eating anything that would irritate a cold sore inside their mouth. So nothing super spicy, super salty, super sour. Nothing with a whole bunch of dry, granular stuff like saltine crackers, that kind of thing. That's the first 10 days or so. We want to avoid those types of things. Well, turn this way. I want to show off your result. So day 5 today. We got the little brow sutures out. Those incisions will be visible within a couple weeks, believe it or not. The incisions that are closed in front of the ear, those stitches will come out on the 7th day. There's a few hidden behind the chin. Those will come out on the 7th day. You can't even see them, but there's lip lift incision sutures. Those will come out on the 7th day. Today we also got rid of the eyelid sutures. And then on the 10th day, we'll get rid of the ones behind the ear on the little clips that are in the hair. These are nicer to hair. They preserve hair follicles better than if we tied sutures in those areas. Anything else you want these guys to know about your first 5 days?
it has been a great experience, for sure. I would do it again.
Not for many years.
I won't have to,
Not
but
for
I would
many
do it
years.
again.
Well, good. Well, thank you very much for letting people
Thank
see
you.
You're just
Thank you.
You're a sweet person, and I really appreciate it. Thank
Well,
you.
you're amazing, so thank
thank
you.
I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.